Greetings and welcome to this edition of the Global Healing Network. Today we're talking to Dr. Keiko Yanai, who's a doctor of physical therapy.
Yes.
And her practice is very interesting. I always tell my students, you have to decide if you want to work with people. Do you want to work using your heart, using your hands, using your intellect? And there are other things you can do as well. But Keiko clearly is gifted with her hands. So, I always ask people so we can get right into it. It's to share a case. Share a case so people can figure out right off who you are and what you do.
So I have seen, scar tissues, especially in the abdomen and in lower pelvic areas, especially after hysterectomy, appendectomy, and hernia. And I have seen those scar tissues affecting lower back, affecting lower back pain, hip pain, sometimes knee pain, and also abdominal pain, causing sexual dysfunction, pain with intercourses, or just, urinary incontinence, and those things are very interesting to me.
So just so everybody is clear, you're talking about scar tissue internally.
Yeah.
Meaning inside in the pelvic area after surgery.
Yes.
Usually it's
post-infection.
The kind of thing that people will get chronic pain, or it's blocking their intestines or the urinary tract from functioning properly.
Yes.
Wow, so what can you actually do with something like that?
So what I do as a manual therapist is always the same. I, find the tightest area, tightest part of the body, and I engage tissues in certain ways that the body can release the tension itself rather than me mobilizing it. And so even when I see scar tissues, I don't just, go into that area. I go there only if the body says that's the tightest spot. So,
just so I understand that. So in my mind, I'm picturing you with your hands on somebody's abdomen, and you find the scar tissue that's there, right? Now, in my mind, the scar tissue is just like real strong connective tissue, like, people get scars on the surface, right? So what actually do you do that would allow the body to release that kind of hard tissue?
Okay, so when I find that scar tissue is the tightest spot of your body, there are usually two things I would do. The first thing I do is to just gather the scar tissue and then give it some slack. Oftentimes the tissues and the scar tissues are being pulled really tight. So give it some slack, and then just like you unwind coils, like, old phone cord, like when you, or, even when you're trying to untangle yarns, you don't just pull, you just give it some slack, and then you kind of untangle.
So, have you ever had any patients that presented maybe with partial obstructions that you were able to help kind of unwind the tissue so that they didn't have to go for surgery?
What do you mean by obstruction?
Meaning the scar tissue was positioned in such a way that it was affecting, let's say, intestinal functioning. They might have had pain. They might have had even a partial blockage in terms of the intestine. Are these techniques that you're using, are they powerful enough to actually to alter that so the person can avoid surgery? In certain cases,
Right. So I happen to treat more with the pain rather than blockage. Okay, so I have treated many people, for instance, with the pelvic floor pain, like severe pain.
Right.
Sometimes it's, just 2 out of pain, and sometimes it's 8, 9 out of 10 pain, depending on the patient. And many people have suffered for the pain for years before they come to me. And, so sometimes, scar tissues are causing it, or, one of the reasons why they have pain. And I go into the scar tissue. If that's the tightest area, I work on it. And then, yes, pain significantly has, decreased. I have very good cases, that pain significantly decreased or just went away.
There's a case in particular that I'm thinking about that we featured on Profiles in Global Healing on Facebook, of a gentleman that had severe stricture of his lower esophagus to the point that he couldn't even swallow water. So while he had the typical gastrointestinal treatment with the balloon that they put down and expand, he was still greatly restricted. And through process of you working with him, he's like 95% better. So can you so that's like a real graphic example of someone that had all kind of strictures. What do you kind of do to help release that he was, and it's not only that, because it's not like you're just working on the local area. I mean, you did stuff on his back and his neck, and it all seemed to be connected for you.
Yes. So for that particular case, restricted when it goes through the diaphragm, respiratory diaphragm. That was one restriction. And also the stomach itself was also tight. And the deep cervical fascia that goes around the esophagus was also tight. And also the crus of the respiratory diaphragm that's attached to the lumbar 1, 2, 3, 4, they were also tight. And I had to work on all of them.
Wow. How long did that take?
So for this specific case, it didn't take too long. I remember he said 20% better after the first session, and about 10% better for each following session. So it probably took 7 to 8 sessions for him to be here.
The other thing is, I want people to get an idea, because I'm sure a lot of people think, God, this must be painful. She must really dig in to really get there under somebody's diaphragm. Like, what is she doing? So talk a little bit about your technique and how that changed over the years.
Okay. So when I started out as a physical therapist, I did a lot of very deep tissue massage, shiatsu kind of techniques. And my hands are very strong. I used to massage my mother ever since I was 8 or 9. So I can really go deep. And I always say I can make anyone cry in 5 seconds. And that's true. And it did work. For about 2 years, I used only those techniques and causing bruises, making people cry. And yet they came back because they felt better after a few days of soreness.
You had a whole nother practice going on there.
20% of my patients, it didn't work whatsoever. It caused only soreness, more pain, no relief of any kind. And it really frustrated me. I can really palpate. I palpate my mother. 15, 20 years prior to getting into this field. So I can find tight spot. I can go really deep, and I couldn't understand why it wasn't helping my patients. And I started taking continuing education courses, and one of them was craniosacral therapy and also visceral manipulation. And they taught me, especially this specific teacher taught me how to listen to the body and where really the cause of the problems are or is. And that really, it was only one day that changed my mind.
Wow.
Yeah, and I totally understood, it didn't work because I wasn't hitting the cause of the issues. And I had to be able to find where the cause in the body of the symptoms that my patients are feeling. And in order to find it, I had to use very light touch. Otherwise, as soon as I use enough force to unless I use the right touch, right amount of force, the body doesn't show me where the tightest spot is, which is usually the cause of the problems. It took me about 2 to 3 years to, go from very heavy hand to very, very light touch. But, with my help with my mentor, I was able to really almost completely switch. And now what I do oftentimes it doesn't cause any pain. Sometimes, scar tissues are tricky. Scar tissues, it's just a tiny, I've seen very tiny scar tissues, like tip of needle. That can cause 10 out of 10 pain. Yeah. Yeah. So, moving a scar, even just a little bit of a scar can cause tons of pain. So in that regard, it can be a little bit painful. Right, however, because I always listen to the body, I don't push the body. I only do what the body allows me to do. So basically, there is very little chance of making mistakes.
This reminds me, as an old Star Trek fan, this reminds me of a Dr. Spock mind meld, where you're literally putting your hand on there, and somehow you're meshing with the body's intelligence. And I'm gathering you're not using more than like a quarter's worth of pressure.
Yes.
In terms of what you're doing, which is pretty amazing.
Yes.
And you can actually feel the fascial planes, the planes of connective tissue.
Yes.
And you can figure out how to shift them and how to move them.
Yes. And it has to be the light touch. As soon as I go beyond the pressure that my patient's body allows me to use, I can't listen to the body anymore. It goes away. It disappears.
That's a pretty interesting technique. So let me ask you, tell me some of the types of problems that you like to treat.
I like to treat migraines, acid reflux, like I said, scar tissues, pelvic dysfunction, urinary incontinence, and typical like frozen shoulder. That's another favorite one because when I was using heavy hand, it was very painful.
Very painful, right?
Yeah, people literally cry. Like 40 years old, guy literally cries, right? But I can do it almost pain-free, almost. Maybe 5 minutes out of 60 minutes is painful, but for the rest of the times, it's pretty comfortable.
Right.
And yet, it's more. I find it more effective.
Right.
Yeah, and again, I find it mainly because the frozen shoulder, the cause is not at the shoulder. You have to treat somewhere else, depending on the patient. It can be diaphragm, it can be the fascia around the liver or kidney, or it may be coming from the head, the neck.
Wow.
So as long as you treat the roots of the issues, the shoulder relaxes a lot better.
And we're still living in an age where pain docs are doing all kind of injections.
Yeah.
To people. And you're talking about something totally different. How is the medical profession accepting your work? What are you noticing?
When it comes to doctors, so when I talk to doctors, I have to be careful. If the doctor is not too open to alternate, techniques. I present myself as myofascial release,
Right.
manual therapist.
Right. And you are that. It's just that your techniques are going beyond what drugs can do.
Sometimes yes, oftentimes yes.
Yes.
Mm-hmm.
I think that's really the crux of it.
Right. So at the end, and because my techniques are very subtle, most people don't realize what I'm doing unless I explain that to them.
Right. Right.
So, if I have to, I do whatever I need to do. And then, for maybe 10 minutes, I do, traditional physical therapy so that the patient or the doctor feels like, well, I'm
Right.
doing what they're expecting me to do. Right? And as long as the results are good, everyone will be happy. That's how I take it.
And I want to say that what you're doing isn't quote unquote magic. People can train; they can actually learn how to do this.
Absolutely.
But it requires a different kind of mindset because you're doing this not with your intellect. You're doing it with another part of your consciousness.
Yes.
And that's what's really beautiful.
Yes. I
agree. Before we sign off, please just share some contact information so more people can either contact you or find out about your work.
So my office is located in Manhattan at 57th Street and 6th Avenue. My office phone number is 212-757-1333.
And I should ask, are you actually doing any training of people at this time?
No, at this time. I just I train my employees, and that's enough for me for now.
Okay. Well, I'm sure people will be reaching out to you. Again, thank you so much for sharing.
Thank you.
Take care.
You too.
Bye.